Sarah, who was diagnosed with systemic scleroderma, an autoimmune disease, determined to understand her condition better, she scheduled an appointment with Dr. Jenkins, a rheumatologist, and Dr. Patel, an lab technician specializing in autoimmune diseases. On the day of the appointment, Sarah walked into Dr. Jenkins' office with a mix of curiosity and hope. Dr. Jenkins greeted her warmly and invited her to sit down. Dr. Patel joined them shortly after, carrying a stack of lab reports. Dr. Patel nodded and opened the first report. Systemic scleroderma is a complex autoimmune disease where the body's immune system mistakenly attacks healthy tissues. This leads to the overproduction of collagen, a protein that normally provides structure to the skin and internal organs. Sarah listened intently as Dr. Jenkins continued. In systemic scleroderma, the excessive collagen causes the skin to become tight and hard and very difficult to pinch, which is why you've noticed the changes in your face and hands. It can also affect internal organs like the lungs, heart, and kidneys. Dr. Patel pointed to a graph on the lab report. Your blood tests show elevated levels of anti-nuclear antibodies known as antititer, which are common in autoimmune diseases. These antibodies target the body's own cells, leading to inflammation and tissue damage. Additionally, we found elevated levels of anti-topoisomerase I antibodies or anti-SCL70, which are specific markers for systemic scleroderma. The diagnosis of systemic sclerosis or scleroderma using anti-nuclear antibody patterns involves several steps. Indirect immunofluorescence, abbreviated as IIF method, is preferred for initial screening. It uses Hep2 cells to detect ANAs and provides information on staining patterns and titers, which help identify specificities associated with scleroderma. Specific patterns are associated with different forms of scleroderma. For example, a nucleolar pattern is common in scleroderma, while a centromere pattern is seen in limited scleroderma, and a topo 1-like pattern is associated with diffuse scleroderma. After IIF, additional tests like ELISA, immunodiffusion, or immunoprecipitation may be used to confirm specific autoantibodies such as anti-centromere, anti-SCL70, and anti-RNA polymerase III. Dr. Jenkins added, "We also performed a comprehensive metabolic panel. Your creatinine levels are slightly elevated at 1.4 mg/dL, which indicates we need to monitor your kidney function closely. Your liver enzymes, ALT and AST, are within normal range, which is a positive sign." Dr. Patel handed Sarah another report. "We conducted a pulmonary function test, and your forced vital capacity, abbreviated as FVC, is at 80% of the predicted value. This suggests that your lung function is within the lower range of normal." Sarah looked concerned. "Does this mean my organs are at risk?" Dr. Jenkins nodded empathetically. "Yes, that's why it's essential to monitor your condition closely." Dr. Patel added, "Your echocardiogram shows normal heart function, but we'll continue to monitor your heart with periodic imaging and blood tests, including measuring your N-terminal pro-B-type natriuretic peptide, abbreviated as NT-proBNP levels, to assess any potential cardiac involvement." As the appointment concluded, Sarah felt empowered with the knowledge and support she received. She thanked Dr. Jenkins and Dr. Patel for their dedication and left the office with a renewed sense of hope and determination to face her journey with systemic scleroderma.